Happy holidays and welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. UnitedHealthcare awarded the Baton Rouge Area Foundation a $250,000 grant to support relief efforts in Baton Rouge to help people recover from the devastating 2016 floods. That money was distributed to 5 organizations, including a $100,000 award going to the Mid-City Redevelopment Alliance. That group has served the Mid-City community in Baton Rouge for 27 years. And while that community did not suffer heavy losses during the floods, it reached out to areas that did, including North Baton Rouge, to help with disaster relief. Karl, Lirette, the COO of UnitedHealthcare Community Plan of Louisiana, and Sam Sanders, Executive Director of the Mid-City Redevelopment Alliance, will join us to talk about what progress has been made to help those affected by the floods rebuild their homes and their lives. And before you give your children a second helping of glazed ham, creamy mashed potatoes, plum pudding, or gingerbread cookies, consider this. According to the United Health Foundation's America's Health Rankings report, 35% of kids in Louisiana are obese. To support a national initiative to encourage youngsters to become more active through exergaming, UnitedHealthcare donated Nerf Energy game kits to New Orleans members of the Boys and Girls Club of Southeast Louisiana. We'll explain what exergaming is and take you to that energizing event in our Community Health Heroes report. And for our Eat Fit Nola cooking segment, we're taking you to Hawaii. Spencer Rossie and Teddy Amar, co-owners of LemonShark Poké on Magazine Street, will be in the kitchen with Eat Fit Nola ambassador Emily Eickoff to tell us about fresh fish salad delicacies you'd be proud to serve at your holiday meals and celebrations. So don't go away. We'll be right back with more Community Health Heroes.
17 years ago, when I decided to become a mentor, that I was assigned to Christina. When she was in the first grade, she was a shy little girl, not able to smile much.
Elaine showed there were people out there to help me and guide me through life. When Elaine let me read her diary, I didn't even realize how important I was to her. And now that I'm mentoring, I feel that importance, and I can spread those same values to the girls I mentor.
Be someone who matters to someone who matters.
Welcome back to Community Health Heroes. Did you know that the epic rainfall in August 2016 damaged more than 146,000 homes throughout Louisiana, caused about $15 billion in damages, and ranked as one of the most expensive national disasters in modern-day history? With us now are Karl, Lirette, the COO of the UnitedHealthcare Community Plan of Louisiana, and Sam Sanders, Executive Director of the Mid-City Redevelopment Alliance. Due to a substantial $250,000 grant, both organizations are helping families recover after the storm. Thank you both so much for being here today. Sam, I want to start with you. Tell us a little about what the Mid-City Redevelopment Alliance does and why you felt motivated to help the people in North Baton Rouge in particular after the floods in 2016.
Sure. So Mid-City Redevelopment Alliance has been around for 27 years. We're a nonprofit organization. We were created by a local hospital. And the focus of it was to just kind of stem the tide of disinvestment in the area just outside of downtown Baton Rouge. And we've been in the community doing work for a very long time. And fortunately for us, when the flood happened in 2016, our area did not take on water. So it made us nimble enough to be able to do whatever needed to be done. So we just went in North Baton Rouge and did what we could to help as many people as possible.
And Karl, I know UnitedHealthcare did a lot too. You gave this $250,000 grant, of which organizations like the Mid-City Redevelopment Alliance was chosen to give $100,000. Can you explain a little bit why you gave that grant and why Mid-City Redevelopment Alliance got a piece of it?
You know, when the flood hit, there was an immediate call to action, and that's big at UnitedHealthcare. Giving back to our community and doing what we can to help. And we got out there where the people were, in community centers, the shelters, and seeing, you know, the effect on these people. But when we came back, you know, we met as a leadership team and we knew we wanted to do something more. and we requested $250,000, and fortunately we were awarded that. From there, we turned and awarded it to the Baton Rouge Area Foundation.
And you acknowledge that this UnitedHealthcare grant was basically the cornerstone of all your efforts. Can you tell me about some of the progress you've made and what you've done with the money?
Sure. I mean, it really made all the difference in the world, because what happened with this particular weather event is that the national response was not this big, robust response. So a lot of people around the country didn't even know we were suffering that way, with that many people affected by the flood. So having groups like UnitedHealthcare actually step up and make an award like that, I mean, I can tell you, near tears in the office when we heard that we were getting this. Because at first we didn't believe it. We thought it was a scam or something like that. And I had to call back and talk a few times just to make sure it was real, because I was in DC at that time.
That's a lot of money.
It was, I mean, definitely. And I immediately thought about what I could do with it. So that's really what was so overwhelming in that process. But it really made the difference in our being able to really equip the folks that we had working in these houses with all the materials that they needed to get in and do as much as they possibly could.
Karl, you mentioned the word partnership. Could you tell me what you've been most proud of specifically with this partnership and the results that you've seen?
You have to think about the residents. You know, you look at what happened, you know, the 100,000 plus that were affected. And when you get out there and see the devastation, I personally went out and drove around, and to see, you know, there was barbecue pits, they were cooking breakfast, lunch, and dinner, you know, to try and survive. And to see the type of work that you've done to get these people back into their houses. They had to struggle. It wasn't just get back to their house. They had to live in their house that was not, you know, they couldn't live in it, but they had to go to work and figure out how to survive. And this group has done an outstanding job of helping those citizens recover.
Sam, tell us a little about the Mid-City Vista Dream Project. What is it?
So that's a national service program. It's an AmeriCorps program, and they refer to themselves as the Domestic Peace Corps. It's an easy way to reference who they are and what they do. Some years ago, we actually expanded our program, so now we actually have 20 members who serve with us on an annual basis. And what we do with them is a few of them serve in our office as full-time extensions of the staff, but the majority of them are hosted by other nonprofit organizations in the community, and it allows us to collaborate better and extend the capacity of some of those different organizations. So we were even able to use them. 4 of those core members were dedicated to disaster response during the flood recovery effort. And it too made a difference, because it allowed us to make sure that the warehouse where we received so much, it could actually get out to the people who needed it.
Well, I wanted to ask you about that warehouse. I think is that the MCRA facility?
Mm-hmm. Yes.
Now that's only going to be open until the end of December, is that right? How can people take advantage of the help they can get there?
So they can call our office, 346-1000, 225-346-1000 is our number. But we're partnering with United Methodist Church, who's actively still rebuilding homes. They're going to take possession of the materials, but we can still connect people to some of those materials as long as they're available.
So even though there's a technical December cutoff, it's still going to be, the resources are still available.
Sure, right. We're just going to shut down the warehouse itself, so we don't have a staff person to run that space anymore. But we're going to make sure that it's where it can be used, and if I still need to pull it to help get projects done, I can do that as well.
Karl, this next question may sound a little silly, but you know, when people think UnitedHealthcare, I mean, you kind of think insurance.
Sure.
You know, so it's so interesting to hear that the organization, the company, is so involved in this type of outreach. Can you tell us a little about that philosophy with UnitedHealthcare? Why, you know, they really try to do this outreach and especially help people in Baton Rouge?
Absolutely. And, you know, I have to say I'm blessed to work for such an amazing company, and it does go well beyond just insurance. When you think about the members we serve almost 500,000 members that are very well underserved. So we have to look at the holistic approach to these members, not just insurance. So you're looking at behavioral health, you're looking at social determinants of health, you know, affordable housing. This is important to their overall health. So that's one big piece that we do outside of just insurance. And, you know, when you look at this storm, I mean, it truly put us all to the test. And all the citizens, but many of our members were affected by this. So we had to get out and do what we could to help them recover, get their lives back, outside of all of these other dynamics they had to deal with. And, you know, as we look at UnitedHealthcare, we have over 700 employees that live here. So we had well over 200 that were also directly affected. So we got out to help them rebuild, get them hygiene kits, get them, cleaning kits, and help them get back on their feet as well. So
It's been about, a little more than 2 years. You think some people are getting back to normal?
They are, but there's still some that need help.
Well, if some people want to help you, help them, how do they get in touch with the Mid-City Redevelopment Alliance?
Well, they can call us at 225-346-1000 or find us on the internet at midcityredevelopment.org.
Great. Well, thank you again both for stopping by, telling us all about this and about the recovery efforts. It sounds really exciting and very positive.
Thank you.
Thank you. You bet.
When we return, how local kids are keeping fit exergaming with UnitedHealthcare donated Nerf Energy game kits. We'll show you more right after this.
I guess sometimes things just happen. Devastating things. Your whole world changes in an instant. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to spot a stroke fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Protect the ones you love. Spot a stroke fast.
Did you know, according to the World Health Organization, obesity has more than doubled in children and quadrupled in adolescents since 1980 worldwide? The National Center for Biotechnology Information has found that exergaming, or active video games, is an emerging technology that uses interactive games to increase exercise behavior, and it's becoming one of the most popular ways to combat obesity in kids. UnitedHealthcare is donating 10,000 Nerf Energy game kits to schools and community organizations across the country, and local kids with the Boys and Girls Clubs of Southeast Louisiana were some of the lucky recipients. More about the games and the benefits in our Community Health Heroes report.
Who in here likes to play video games? Me! Oh, everybody, huh?
UnitedHealthcare donated 75 Nerf Energy game kits to pint-sized members of the Boys and Girls Clubs of Southeast Louisiana in New Orleans as part of a national initiative to encourage young people to become more physically active through exergaming.
Exergaming is a combination of exercising with screen time video games. So a lot of times kids are often glued to a TV set playing a video game. Well, this exergaming allows them to exercise, earn points, and then apply those points towards screen time and video games.
With the help of UnitedHealthcare mascot, Dr. Health E. Hound, UnitedHealthcare's Nelson Raines distributed the Nerf Energy kits to the energized kids who couldn't wait to go outside and play. The Hasbro and UnitedHealthcare donation is designed to get kids moving with these kits that include a Nerf Energy game band, a Nerf Pro Foam soccer ball, and instructions to download the Nerf Energy Rush mobile game. As children participate in physical activity, they earn energy points that are tracked by the activity band, and these points turn into screen time to play the mobile game on a smartphone or tablet.
For years we had kids, before social media, before computers, before video games, you spent most of your time outside playing, and that's not always the case. And depending on which city you're in, or maybe there's not parks or places for you to go out and play. So this gives you the opportunity that even in a small backyard, you can go and do some fitness activities and then earn points to go play those video games. So it's tremendous in getting them to think about fitness as a reward, and the big reward is going to come later in life, that they're physical fit, healthy lifestyles, which play in so many roles in their life. That's going to be tremendous.
Thomas Falgout, the president and CEO of the Boys and Girls Clubs of Southeast Louisiana, sees the data in motion every day. According to the latest United Health Foundation's America's Health Rankings report, 35% of kids in Louisiana are obese. He said that's due in part to not getting enough exercise.
And our kids who come to Boys and Girls Clubs a lot of times may not have the opportunities that they need and the support systems beyond Boys and Girls Clubs, beyond maybe at home or school. So this is just another opportunity that, thanks to UnitedHealthcare and Hasbro and the Nerf ball and the Fitbits, and so the fact that kids will participate in fitness activities, the Fitbit will give them points to play video games. And the more fitness you have, the more points you have. Kids today a lot of times are sitting down watching video games, not necessarily playing, so this will give them the opportunity. You want to play more games? Let's go and do some fitness activities.
If you can get people doing stuff at an early age, and they're more likely to carry those in as they age, and then also if they're not obese before they get older, then they're typically less inclined to gain that weight. And what a lot of parents might not realize, or the public might not understand, is that being obese as a child can lead to other serious health conditions such as diabetes, heart disease. So it's very important.
Okay, time to rotate. Rotate, guys, rotate.
So the Fitbit is great because it measures their activity and their fitness, and then it rewards them with points to go play video games. So in today's world, where a lot of our kids are playing video games and maybe not as fit, which is why we have such high rates of childhood obesity, you'd want kids to participate at least 60 minutes a day of physical fitness activities. Doesn't have to be all at the same time. So this Fitbit, if you're wearing it, walking, anything and everything you're doing is fitness, and it gets people to understand that it doesn't have to be all at one time. And the more you do, the more fit you are, the more activity you participate in, the more points you earn that you can play video games. So it's really cool. Have people like Hasbro and UnitedHealthcare come out and say why you should be fit, why is it healthy to be fit, and it's fun. And so that's huge for kids who always looking for something fun to do, and now you can pair it together.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you eat stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
I'm Molly Kimball, registered dietitian and founder of Oxner's Eat Fit Nola. We've collaborated with more than 100 partners locally to create Eat Fit Nola, a partnership that highlights the better for you items right there on our restaurant's menu or on grocery store shelves, making it effortless for you to dine at your favorite restaurant or shop your favorite market without ditching your otherwise healthy diet. Every month, Community Health Heroes Show, which is sponsored by the United Health Foundation, will shine a spotlight on an incredible chef to help show you how you can make smarter food choices to live a healthier, happier, and hopefully longer life. In addition to Eat Fit Nola, you can find our partners such as Eat Fit North Shore, Eat Fit BR, Eat Fit Bayou, and coming soon, Eat Fit Acadiana in a neighborhood near you. So don't go away, Community Health Heroes will be right back.
This holiday season, say aloha to some fun and healthy dining options, including poke dishes with spicy sushi and savory toppings. Joining us now are Spencer Rossie and Teddy Amar, co-owners of LemonShark Poké at 2901 Magazine Street. And of course, Eat Fit Nola Ambassador Emily Eickoff is here. They'll all tell us how to incorporate some high-quality poke into our traditional holiday meals. So thank you all for joining us today.
Thanks for having us.
This is just beautiful. So I first want to ask you, what is poke and what's a poke bowl?
So it's a Hawaiian dish. That's where its roots come from. We've kind of got the mainland version here now. But cubed fish, marinated is the basis of it. We kind of take it, do a little spin on it, put a base, which is some of the greens, and then a lot of toppings like seaweed salad, edamame, serranos, a little sauce, all that good stuff.
Everything smells delicious, looks so fresh. So you can make a bowl, but there's like a zillion combinations, and I looked on your menu online, and oh my gosh, there's a bunch of different bases. Was about 12 pokés that you can choose from, or 14, and then a bunch of sauces and toppings. So you're going to be making some bowls for us. How do you even know what to put together? Like, what tastes the best? Can you pick and choose, or do you?
So we've got our signature bowls. Our signature bowls are some that we've already put together for you. You can choose from those. My favorite thing to do, though, is we've got a line you can go down and literally select what you want. We build it right there in front of you so you get to see it. Our team is excellent at letting you taste, recommending combinations that go well with sauces, with the fish, with the vegetables, anything like that. So it's a lot of fun getting to put it together right in front of you.
It's like build your own hamburger, right?
Right, yeah.
So which bowls are you going to make for us today?
So today we are going to be making the Aloha Tuna Bowl. Got a couple different of our tunas in it and a lot of our different toppings.
Gotcha. As you start making that bowl, Emily, you got to start telling us, how is all this good for us? Like, are some things better than others on this table? Or when you do a poke bowl, would you recommend certain items in particular?
Yes, so for our Eat Fit items, we recommend the mixed greens as the base. These are nutrient rich and very, very good for you. And then we love the rainbow we have going on right here. You see, pink, orange, green, and adding all of those in really provides a great meal that not only tastes good, but you actually feel good after eating it. So we really love these types of meals.
Now, if I recall, even though we're just working with greens today, different bases includes wontons, noodles, and really fun different.
We do. We've got a variety of rices. We've got a traditional white sushi rice, brown rice. We also have a forbidden rice, which is a black rice, soba noodles, wontons, and quinoa. So we've got a huge variety of just the bases that you can put the poke on top of, and then all your toppings as well.
So Teddy, you've gotten busy doing this. So what are the ingredients so far that are in here?
So we started with our mixed green base. And then going from there, this is our spicy tuna, and this is our regular ahi tuna.
That's so pretty.
Yep, and so the spicy tuna we marinate in the store, and then the ahi tuna, we have a couple different sauces that go directly on our poke. Unfortunately, we didn't bring any today, but you can also get sauce directly on your poke and sauce on top of everything.
Now, in terms of portion size, I was kind of joking with Emily before this, like how many can you actually eat? Because everything looks so healthy. So can you just shovel bowl after bowl down, or should you just stop at one or two?
So I honestly think this is gonna fill you up. It's about 600 calories, which is a good number of calories for a meal, and over 30 grams of protein. So you're going to be so full that you're not even gonna think, I'm still hungry after eating it.
30 grams of protein.
And that's with the greens. So I mean, rice can make it a little bit more filling, but to meet the Eat Fit criteria, definitely go with the greens.
So if I'm not mistaken, a little bit of cucumber here?
So this is actually our cucumber salad. So we have regular cucumbers, and then we have a cucumber salad as well, which is just kind of like a nice little glaze on top of the cucumber.
So pretty. And
seaweed salad.
I gotcha. So now, is this all the elements before your sauce?
So yeah, we're gonna keep going for a little while longer. Sauce is one of the last things to go on. That way it could cover the complete bowl and really get that flavor.
Okay. And what are those?
This is edamame.
Okay.
Shelled edamame.
Protein-rich, plant-based item. Very good for you.
I gotcha.
And then this next one is red onion.
So did you really figure out how many combinations you can make at your restaurant?
We haven't put the math on it, but I mean, it's going to be in the endless. I mean, every time you come in, you can absolutely try something else. And we've got so many regulars that do that. They kind of know what they like. They've decided on the protein or some of the sauces, but they constantly kind of mix it up. I get a different bowl almost every time I'm there.
Really?
Yeah.
Wow. And it looks like you're done with all the big stuff. Do you add that as well?
Yep, so we're gonna do the sauce first, and then this is crispy garlic. That'll go on top as like a topping. We've got, in the store, we've got crispy garlic, crispy onion, and macadamia nuts as well for like a finish off the top of your bowl. And this is our spicy mayo.
So Emily, in looking at all the different sauces, because there are quite a few, are there any in particular you'd recommend or tell anyone to steer away from? Or?
Yeah, so we love the spicy mayo and the ponzu. You just are watching out with those portion sizes because it can kind of creep up with the sugar and the salt and everything. But as long as you're keeping everything in moderation, yeah, you're good to go.
And lastly, this is our eel sauce.
Now, for someone who doesn't really eat a lot of sushi, eel sauce, what is?
So it's named eel sauce. There's no actual eel in it. It's a sweeter kind of a ponzu that in traditional sushi is always paired well with eel. Kind of got its named eel sauce, but there's no actual eel in it.
I gotcha. So this is when you go to LemonShark Poké. This is dinner, huh?
That's it. Yeah.
Wow.
Yeah.
Top it off with some crispy garlic.
Well, I'll tell you, I feel kind of funny now about that question I asked about how many can you eat, because this really looks like all you need is one. I mean, it's
filling, right?
Yeah, and you put so many elements in it. I bet. In terms about the flavor profile, are there certain ingredients that you think really go well together? Like, would you recommend, like, if you come to my restaurant, definitely try this?
Yes. So I'm a huge fan of the tuna. I feel like it's just like a staple that needs to be in every bowl. Same way with this bowl, it's got the spicy mayo and the eel. I think that's one of the combinations that just across the board everyone's kind of liked, putting those two sauces together. And our cucumber salad, it's a house marinade that, I mean, we've got regulars that come in just buy the cucumber salad on its own. It's been a huge hit.
It looks fantastic. So tell me a little about LemonShark. It's actually a franchise, right? And it's inspired by an actual lemon shark because they're very discerning, I hear. Can you tell me a little about all that?
Sure. So, so LemonShark is a fish that kind of feeds on the bottom. It eats almost anything it comes across, but then anything that it doesn't like, it will discard of, and it's only searching for the highest quality ingredients in the sea.
So I take it you search for the high quality ingredients as well.
Right. Just like us.
Where do you find the high quality ingredients? Like if you want to find really good fish to serve at your restaurant, I mean, do you try to source local or?
We do some local sourcing. A lot of the things that we pay attention to is the sustainable sourcing. Everything that we have in the house is single line caught, meaning no nets. It's sea mammals, sea turtle safe. So it's a lot of really safe fishing practices that go into it as well.
This is a great demonstration, but it's kind of curious that we're having this, at the end of the year. Would you encourage people to, maybe add this on their Christmas table, or is this something that people should just take advantage of, maybe where they're Christmas shopping on Magazine Street, or what do you think? Do you think this would be great next to a big turkey?
I think it could definitely fit in at your Christmas table, but I think the best place it fits in is before and after. Getting that healthy, meal before, getting the healthy meal after, getting that new year, new you. And so I think that's where, if you're out shopping on Magazine, doing anything like that, we definitely fit in there.
Gotcha. Emily, how did Eat Fit Nola find LemonShark? How did you all create this relationship?
Yeah, they actually found us, and so they're one of our most recent partners, and so we're really excited to have y'all on. It was a really easy process because most everything fit our criteria, so there was no modifications or anything like that necessary.
That's incredible. This is so pretty. It's mesmerizing. You see all the pretty colors really dancing everywhere. Emily, tell us a little too about Eat Fit Nola. Any fun announcements for the end of the year?
Yeah, so of course we have our Eat Fit smartphone app that you can download on Android or iPhone, and you can also find all the nutritional benefits of these dishes on our app. We're also redoing our Ochsner Fitness Center cafe, and so you don't even need to be a member of the fitness center to come in and eat all the delicious options.
And that's new, right?
Yeah. So they're launching in January, so keep an eye out for that.
That's really great because you don't have to be a member. You can come in, so a lot more people can take advantage of all the wonderful food there.
Exactly.
That's a great little addition.
So it's a really good option to keep in mind.
Well, I can't thank you all enough for stopping by towards the end during the holiday season to show us this wonderful demonstration. We're going to be highlighting your creation on our website at communityhealthheroes.org, and also post this on Facebook. So thank you all again for joining us.
Thank you for having us.
Yeah.
We'll be right back.
Hart, what's going on? I'm leaving. Why? What did I do? Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit. Okay, I get it. I'll do better. Just please, don't leave. Okay, but remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit Nola restaurants, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we've provided you about UnitedHealthcare's grant to help flood relief efforts in Baton Rouge, how to get your kids exergaming to keep them active, and how to incorporate Poké into your holiday meal will help you and your family live healthier, happier, and longer lives. I'm Leslie Snodowski. Make sure to join us next time for more Community Health Heroes.